Okay, we're back. I'm your host, BKP. Good morning from beautiful downtown Blue Ridge, Georgia. Don't forget, a live show. We may hear the scenic railroad in the background. We may see some trucks go by, a little bit of background noise, but we power through it because we enjoy small town America starting up on Friday morning. I'm here with Dr. William Whaley. Thank you, Georgia Cancer Specialist affiliated with Northside Hospital, for this segment. Ask the doc. How are you, sir?
I'm great. You didn't ask me about my tie.
I was getting that.
Oh, all right.
I mean, that's next.
Next. All right, go ahead. I want to point out that Brian has a new haircut. He's going to be talking to the Republican nominee for governor this morning, and that's a real coup. They had to come together meeting yesterday.
Yes, they did last night.
And he's wearing these glasses that are called space-age trifocals. And he's the only guy who wears these glasses with that name. The other people wear them with another name. All right, this tie.
I knew you were going to get me.
I knew you were going to get me. That's an inside joke. All right. I usually wear a tie to highlight something, and this is this tie does not go with this shirt. And everybody knows I'm a sartorial, just stepped out of GQ magazine, but I'm wearing this tie. If you'll notice, this is my Christian tie with crosses on it. Now, why would I be wearing a tie on a Friday afternoon? We have a pastor in Turkey that
well done. Go ahead.
My man.
Well done.
Okay, I just want to. I want you to think about Rocket Man. Mm-hmm. He began by calling him Rocket Man, and then within half a year, is meeting with him and getting concessions. He put onerous tariffs that everybody complained about on Europe and on China, and it took about 3 weeks to get the EU Commerce Secretary over here right, to get the thing started. Now, you were saying that this might favor us, might favor the EU. I think both of them. I think Trump wasn't wanting to favor anybody. This trade deal shouldn't favor anybody. But anyway, he got them there. Well, he started talking about that man in Turkey, 48 hours ago, and I believe something's going to happen. So I'm wearing that today in honor of Mr. Trump.
I do not have the name in front of me. It escapes me, but there's a pastor in Turkey that has been
2 years
2 years imprisoned on false charges, but 2 years imprisoned, and Trump said Turkey needs to release him like ASAP.
Well, Turkey's the home of Ephesus and all of these places where Paul went. Christians are over there all the time. They're doing various kinds of work. So I mean, there's hundreds of Christian missionaries in Turkey, and they picked on this guy when the Iman started that revolution against him. Okay, well, we got to answer some questions.
Okay, we do have a question here.
Is that what we're here for, Carissa?
Yes, but this one I have personal interest in because I experienced this. First of all, we're going to be talking about spasms and cramps, period. But what causes spasms and cramps in a person's back? Sometimes I'm working when it happens. I sit at a desk, and sometimes I'm laying down. I exercise moderately and have for some time, but the back spasms are new. Other than this, I do not have pain in my back. Should I be concerned?
Well, first, should I be concerned? I think the answer is probably no. But you don't want to hurt real bad. So concerned means, oh my goodness, I got something horrible. This questioner has told you that I do not have structural back disease. I do not have back pain other than under these circumstances. So there's an ad on television for this very desk that you stand up to work on your computer.
Yes.
My daughter here, who's a executive with a large company in Philadelphia, has a workspace. I asked her, did she have one of those? I don't need it, but I have the opportunity to get one. So the first thing that you think about is prevention and causation. So if you're just talking about spasms that occur not related to having structural disease in your knee, your hip, or your back, the common things that are preventable are dehydration. If you sat there a real long time and you're not keeping your tab or your bottle of water there, Are you taking a medication like a diuretic for high blood pressure, things of that sort? Have you done some unaccustomed work last week? Did you get out there and shovel the snow or rake the grass? In other words, do something you're not conditioned to, and then 2, 5, 7, or 10 days later, your muscle starts to complain about it. So we're going to assume that none of those things are present. Most commonly, then, it would be posture. You know, you walk wrong or whatever, and that you can help prevent that by improving your posture. You can diminish the frequency of them by going to the gym and letting the personal trainer show you core strengthening exercises or things that help in that fashion. But getting back to your comment, we're going to talk about cramps in general. We talked about the leg cramps, you'll remember, not too long ago. And once when you get one, I mean, it's as bad as a kidney stone. I mean,
yes.
you're hurting like crazy. The way you're supposed to help those cramps that you've got in your calf and in your thigh and so forth is to get up and stretch them. So when you have that cramp and you're sitting at your desk, then you should get up and go through the range of motion of stretching them and so forth. Amanda, grab that chart now. Now, we're talking again about non-structural, non-medical treatment of your back. And if you take a look at this chart, that showed up there. You see that big old chart?
Yes.
It's got 20 lines on it, none of which are medications. And they are things that are known to diminish the intensity and the chronicity of these back issues. Acupuncture and exercise and stuff. Anyway, so the point I'm coming to is this is a very common issue. It is not a drug issue. It's not a go get an x-ray and an MRI issue, because the questioner told you they do not have back pain other than the cramp getting them at certain positions. Is that enough for you, Amanda? Because I could go on for hours about
cramps.
cramps.
Here's the thing, though, and I was glad we were talking about cramps and spasms. My worst spot is calves. Just all of a sudden I'll get a knot, and it's like, I mean, just like you said, kidney stone, and my foot draws and everything. And
when you get my age, it occurs almost every night. Now, when it's occurring to you, is it at night when you're asleep, or is it occurring at day?
No, not in the day. Usually
okay,
not in the day.
Fine. Then you are going to, the quickest way to get rid of it is to get up, stand, and stretch, as we showed here before. But that is a natural biological occurrence as you age. It's thought to be due to a wearing out, so to speak. One of our expert panel sitting over there with a full head of gray hair. So it hadn't fallen out, but it's changed color, right?
Yeah.
So that hair's gotten, it's ran out of color. Well, the membrane and the calcium going back and forth across the membrane gets a little messed up as you get older. So people in our age group really should be taking some supplemental calcium, as we have mentioned before. And if you do have cramps, taking a supplemental calcium might help you. But it's natural, biological, and you don't worry about it. It gets worse and worse each decade. So.
Yeah, but you know what I've noticed, and it just dawned on me, I've noticed is we ask you questions every week, and then I jump in and do a little follow-up, and then you always start out the answer to my follow-up. That's normal as you age. How do I age?
I sometimes say, it's better if you lose weight. That's the other one I give you.
Oh, God.
Right? Okay,
all
so
right, moving right along.
Answer is no, the other one is exercise. Exercise, lose weight, and you're getting older. So
nothing
that's
to
a
see here.
thing.
Move along.
All right.
Yes, I do. I like to eat bananas. That's true, and that is.
The bananas will help you. Yeah,
I do. I stop and get bananas, and I do like I said, nighttime is the worst time. Is there a correlation? I like this question because I think a lot of people are thinking about this on a daily basis. Sometimes myself. Is there a correlation between diabetes and cancer? Is there a higher risk for women with diabetes to get cancer than men with diabetes to get cancer? Correlation? And is it more prevalent in women and men, or how?
Well, the answer to every one of those questions is yes, yes, and yes. And generally I say maybe, maybe, and no. So let's go back a little bit. 25 years ago, coffee was bad for you. It gave you pancreatic cancer, and 8 years after that, coffee was good for you and it prevented cancer, and birth control pills caused you to have cancer, and then they caused you not to have cancer. So this debate about diabetes being linked to malignancy has gone back on for decades. Once the body of evidence gets really huge, it's done so by what we call meta-analysis, which means you take all of the published studies that are out there, let's say there are 20, that are well designed, you trust them, peer-reviewed, published in the Journal of the American Medical Association and not on some kooky website, and add them together and analyze them. And the meta-analysis has just recently been published, and I think that somebody must have seen this, and somebody must have seen this in an ad. I mean, in a news place somewhere. But this is what the meta-analysis said: the link between diabetes and the risk of developing cancer is now firmly established. So I would say first, yes, there is a risk. Now, they go back then and start backpedaling. People who have diabetes tend to have some other known risk factors, like they're older in age, they are generally overweight, they generally do not have as much physical activity, because if they lost weight and started exercising, they may no longer be diabetic. Right, Amanda? All right. So if you try to correct for weight, inactivity, age, poor diet, socioeconomic class, various things like infected foot ulcers and stuff in the diabetics, and get all that out of there, there's still a bigger risk. So taking out those risk factors, there's still a bigger risk. First is colon cancer and diabetes increases the rate by 38% in diabetics, rectal cancer 20%, and females a little bit more than males. Now, the theory behind what that is due to is insulin and insulin-like growth factors stimulate growth of tissues. And that's one of the things that people do to young children and adolescents nowadays, like growth hormone shots to try and make your son be big so he can get a college scholarship. So the use of the insulin-like growth factor and insulin levels are higher in the type 2 diabetics than they are in the normal population. So the thought is that insulin-like growth factor and the insulin stimulates the growth of the cell that makes the malignancy. It is more common than the biggest number is in colorectal and rectal cancer. But it's also true, the difference between men and women in kidney cancer was small, 11%. These other ones I said were 38 and 20. Oral cancer is 13, stomach 14. You don't really care. But the biggest one then is colorectal cancer. The answer is yes, and the risk is not solely related to diabetes, diet, or the like, because when you go correct for all of those, it still stands. How's that?
That's pretty good.
Just learned something, didn't you?
Yeah, well, but the yes, yes, and yes. But you said that. Could you read that line for me again? That you read it. There is the
link between diabetes and the risk of developing cancer is now firmly established.
Firmly established. Okay, that's
a scientific word.
Huh?
Firmly.
Well, firmly, and I know what I don't know what they're saying. You would be able to translate that, but when they're going to step out and say firmly in a study, then that's a little different than some of the things they release.
Tendency, trend.
Right, tendency, trend. Thank you.
All right, now, one more thing. You said the study. I want you to go back to what I said. This is not a study. This takes 20 studies. These are called meta-analysis. So it has much more statistical power than one study. So that's really important.
Well, one of the reasons I wanted to double back to that is because when it said firmly established, early on when we started our series with you, we would discuss, and I think we discussed one time, of how to read, not meta studies, but studies or things that come out, how to read those. And when you brought that up before, when you read link to and this and that, there's a different way.
Absolutely.
And that's a strong statement, firmly.
Right. Well, I want to give you one that's not firmly established, since we talk about the medical news every week.
Well, that's where we're at.
All right, we're at medical news. Where's Jane? Well, all right, Rick, you got to carry this information into the next segment, because you know my wife is convinced that you and I are killing ourselves with these, right?
Rick is over here, All-Star Panel, waiting in the wing, has his tab. Here. Dr. Whaley has his tab. So this is our tab update of the week. Go ahead.
Could diet soda help curb colon cancer's return? Now that means recurrence after the diagnosis of colon cancer. People in a recent study who drank one or more 12-ounce servings of artificially sweetened soft drinks a day had a 46% lower risk of cancer recurrence or death over the study period than those who did not. Now, that's one of those things that people are going to leap all over, and that is not a scientific. That's just a tiny little study. So
it had the word occurrence in it.
Yeah, right, and trend and all the rest of that. So that's a medical news thing that people, when they're going through the checkout line and they see the National Enquirer there or People magazine or something, it's got that kind of headline, it gets in their head that this is absolutely true.
Actually, that's a follow-up perfect to what I was, my question is, you know, a possible reoccurring or reoccurring. You just hit right exactly what I was talking about with the meta study saying firmly connected, and this is a reoccurring. So we give you a little pass, but that's almost like a National Enquirer.
I know it. And I hope.
But I will follow.
I was really hoping that my wife would be here by then. All right, now the next thing is that part of every. I mean, there's not a person here who hadn't been addicted to Oreo cookies at some point in their life.
I can't win on this show.
No. I'm not. The Oreos is not. Except my grandson was talking about having a deep fried Oreo at the fair the other day, and I almost got sick listening to the story. But the other thing that I think is a firm part of all of our lives are Ritz crackers.
Amen. You know what? Thank you, because I want to say on this show, if you're wondering, like, you know, should I watch? Last week, right here in Blue Ridge, on this show, this man, Dr. Whaley, beat all the national news.
I did.
Beat every last one of them. Right here, you got that information. Ritz crackers, you went through that last week.
I did. All right. Now, since I went through that last week, they were recalling one or two products, which were the little small ones with peanut butter in them. They have now recalled every product that they make that has a peanut butter in it. Now, you'll remember that the guys went to prison from the peanut butter factory down in South Georgia. That's been about 5 to 7 years ago, where they hadn't fixed the gutters, and they had the water inside, and then the rats put the salmonella in there. So if you just think, if you got one place where they got peanuts and they got salmonella on them, and then it gets to some big old factory where they take 40 different sources and throw all the peanuts in the same thing and mix it all up, you only have to have a small contaminant to contaminate the whole doggone product, and you got tons of it. And I mean, there are some people that are going to go into epileptic spells and withdrawals if they took away their Ritz, because I mean, there are people that eat Ritz crackers every day. So I think it was important that we brought it up last week, and that's another one of the news things.
Well, there's goldfish crackers, and there's
you can change.
Yeah, well, no. Well, no, they've been recalled if you have,
any spring mix, Ritz crackers,
right?
Goldfish. There's a big list.
A big list.
Romaine lettuce.
Romaine
lettuce is back in the market now.
I think it went back out last
Oh, wait. Ptomaine, romaine, Jane.
Spring mix.
Ptomaine, romaine. Jane just filled our refrigerator up with lettuce last night.
All right, well, let me ask you this, because I appreciate it, and I will say that let's double down on that a little bit, because I know we have to go. There's people out there going to the grocery store now, and they're looking at the shelves and saying, "What can I eat?" So if you like salad, do you get the head of salad? You get rid of the bag. You get a head of salad.
That's right.
You cut it.
Yeah.
You put it in the strainer. You wash it real good. That's the best way we go?
Yeah, you buy a cucumber and you wash it. You cut it any way you want it. You buy celery and you wash it, cut it any way you want it. And when it's like people who say, "Can I take a diet pill or something?" They want a quick fix that's going to make them rich, thin, good-looking, and not put in the labor it takes to cut calories and start exercising. Well, it's gone over to our food. We want to get instant food, instant meals. And my daughter in New York City gets her food from Fresh Direct, and it comes in there and the salad's all chopped up, and all you do is take the top off and pour the dressing in it, and you got a Greek salad. So there is danger in that, or potential danger in that great convenience at a higher cost. So if you really want to be conservative, you buy at your local market, you clean it yourself, you slice it yourself, and that's the same way with the fruits, because that stuff about those chopped up fruit things, everybody in my office
they go
brings
and get
one.
a fruit cup.
Yeah, they got them in my office every day at lunch, and if there's none of them on the list now. They've actually got those ones from a few weeks ago, but the one that's still on the list is all in a small snack pack thing, and they were being sold. The biggest place they were being sold was in Quick Trips and all of those highway-like stores where you pull in and you want to buy a snack and take it on the road. And that epidemic then got people all over the country because it was folks on highways, and it was very difficult to figure out where they got in the.
I do this crazy thing, Dr. Whaley. I buy like the whole watermelon and the whole cantaloupe. I know it's unreal. But the other day, as silly as this sounds, I bought a cantaloupe because I love cantaloupe, and I buy a couple a week. And I went home, and I've got a container with a seal on it. And I said, okay, and I took my phone, I took the timer, I know I'm lost my mind, okay? And I said, how long in the world does it really take to wash this cantaloupe off, cut it, peel it, cut it up in chunks, and put it in a storage container in my refrigerator? I think I had 8 minutes invested in that cantaloupe. And that's processed versus unprocessed foods. A couple more minutes would be better for us.
All right.
Am I wrong?
I've got a question, though.
I knew I opened myself up. What?
Serious question.
Okay.
Were you off of your cell phone and your electronic devices for the entire 8 minutes? Or did you stop in the middle of the production and do an electronic thing during those 8 minutes?
I refuse to answer that. I can't answer that, and as long as I'm not in the court, I don't know. I don't remember if I did.
What do you think, Amanda?
Amanda?
I think that during that 8 minutes, he stopped and did something to this.
Absolutely.
I would believe it. 8 minutes to me is withdrawal for him. I mean, unless he's on air. If he's on the air, yes.
Where did this go? I was talking about washing a cantaloupe.
I know it.
How did you get me on this?
Well, I don't know. We just got you there.
Thank you. Thank you for your tie. Thank you for remembering the pastor in Turkey. I appreciate that, Dr. Whaley.
And I didn't give you the joke today because it was a terrible joke, and Ray didn't give it to me.
Thank you, Georgia Cancer Specialist. North Georgia Cancer Specialist, thank you very much. Affiliated with the Northside Hospital. I want to thank them for this segment. Ask the Doc. You can find it on our YouTube channel. Share it with your friends. Great information on FYN TV, Fetcher News YouTube channel. We're going to take a break, and it's time for our All-Star panel.